Hello viewers, welcome to Ayurmegha Health World. Every year, almost 10 million people are suffering from the pain of piles due to constipation, stress and by leading a sedentary lifestyle. At some point, every individual between 45 to 65 years of age would come across the pain of piles, and large number of women experience these piles during pregnancy. In today's video, we are going to discuss detail about anorectal disorders. To explain in detail, we have Dr. Nidhi Navani, BAMS, a highly qualified Ayurvedic doctor with more than 20 years of experience, and she's also a Ayurveda physician for piles, fissures and fistula, and also in curing various health issues like spine, joint pains, rheumatoid arthritis, osteoarthritis, sinusitis, insomnia and stress. So let's get into the video and talk to a doctor. Hello ma'am, how are you?
Namaste, I'm good.
Ma'am, we have been seeing many are suffering from the very common problem that is piles, and many complain that though we undergo surgery or operation, still we are facing that problem and still it's reversing. So what are the common anorectal problems that they are suffering from?
See, now when you mention piles, there is a very general notion among the public that all anorectal problems are piles, but it is not so. So in anorectal problems, so it's an area where the problems are developed in the perianal area or around the anal opening. So there are different problems in that area. The main problems are like piles, fissure and fistula, many a time perianal abscess. So these are the common problems which occur, and all are different problems. But because see, in general public the notion is any problem in that area, they say it is piles, but it is not like that. They all are different problems. Okay, now coming to piles, piles is like, when we have a growth, suppose this is the anal opening, when we have a growth in any of this part, it can be 3 o'clock position, 6 o'clock position, 9 o'clock position, 12 o'clock position, depending on the part of that anal opening where it is growing, that small tissue mass, we decide, okay, this is the exact location of the pile mass. They can be internal hemorrhoids or external hemorrhoids. Plus, see, there can be many a times it is just a simple skin growth where there is no pain. Then there are times when there will be swelling in that pile mass, in that tissue mass, in that growth, and there will be lot of pain. So whenever there is a growth associated with swelling and pain in this anal opening, that is termed as hemorrhoids or pile mass. Now coming to the second problem, which is very common, very common, it is fissures. So what do we mean by fissure? Now fissure, again, this is your anal opening. There can be a small scratch kind of a cut which slowly becomes deep and it becomes a permanent cut kind of a thing, and from there bleeding also happen may time and can be painful. At times, there is little burning sensation after passing the motion. That is known as fissure, and it is very common in people who have constipation. Another common problem in anorectal area is fistulas, okay, or perianal fistulas or perianal abscess. So what happens in fistula? In fistula, there is a channel, a tract which develops. It has two openings. One opening will be in the external perianal area and the other opening will be inside the anal tract or inside the anal opening, and there is a tract, and through that tract lot of pus will pass out, okay, and it gets infected and it can even further go inside and develop other pus cavities or develop further fistular tracts. That is a very painful disease, okay, and similar something to like that is a perianal abscess where a pus cavity develops and pus keeps on forming and gets collected in either of this close by areas in the perianal area. So these are the different types of common diseases what we have in anorectal problems.
Ma'am, what is the root cause of these piles or fissures or fistula?
Now see, the root cause of this problem starts from our digestive system. The kind of food what we eat, the kind of lifestyle that we are living, it is all an addition to all, it's adding to all these problems. Basically, piles, fissure, fistula, they all are lifestyle disorder, because if we are following, there is no routine in our eating habits. If we are eating a lot of junk food, by junk food I mean lot of fried items, deep fried items, items containing lot of spices, then maida items, because maida doesn't contain any fiber, so it gets stuck to the intestines, right, and it takes a lot of time to cleanse that maida away from the body. Okay, so all these junk food items, they cause digestive issues. Lot of non-veg, because non-veg takes lot of time to get digested, and so there is lot of fermentation happening inside the intestines when we eat non-veg. It stays for a longer time, and as a reason, all these causes, they make a patient go constipated. So in constipation, when they are not passing regular motions, motion becomes very hard, and when they try to forcefully pass the motion, there are chances, that because this area being very sensitive, there are chances that they might develop a cut over here. So for initially it will start like a scratch, patient will feel mild burning or just a mild pain, followed if it goes on continuously, there will be a daily pressure on this cut, and it will become a permanent cut kind of a thing, which further leads to bleeding from that area. Many patients, they experience they're having burning sensation, bleeding in their anal opening. Yes, inflammation definitely will be there. Once it becomes tender, the entire area will be very sensitive, and that inflammation will be there, and it will be painful. They'll have a painful day throughout, because if they cannot sit properly, they cannot sit for longer hours, they cannot focus on their work because of this continuous pain in their anal area. The constipation is the main problem which causes this problem, and the reason for constipation is the way we treat our body.
Apart from constipation and a sedentary lifestyle, do stress plays a major role now?
Yes, of course. See, because stress will not let you have a peaceful sleep, and the entire digestive enzymes get disbalanced, your hormones get disbalanced, which again causes the digestive juices, they don't get secreted properly, and again it causes a lot of constipation and lot of bloating and flatulence in your stomach, and which again adds to these anorectal problems.
And what are the symptoms of piles, fissures and fistula?
Yeah, see, piles, as I mentioned, there will be a small growth in and around this perianal area, or internal hemorrhoids, there will be a small growth inside the anal opening, and that growth will have little bit of swelling associated with some pain, and there can be multiple growth also. It's not that it's always only one growth, it can be 1, 2, 3, 4 growths like that. Okay, then coming to fissure, fissure is associated usually with lot of pain in that perianal area, especially while passing motions, and especially after passing motion, patient gets burning sensation for at least 1 to 2 hours, depending on how severe the fissure is or how deep the fissure is. Plus, after some time, patient will also experience bleeding while passing motion, or after passing motion also there is a tendency to bleed from the anal opening. That is a first symptom of fissure. For fistula, there can be an opening in and around in that perianal area, and there will be pus coming out or some discharge coming out from that area, plus there will be at times there will be bleeding also from that area, plus it will be a very painful condition. Patient is unable to sit for 15 to 20 minutes, more than that the patient is not able to sit because of the continuous pain.
How do you diagnose this, ma'am?
Okay, so now coming to the diagnosis part, see, first there is a manual process to examine all these piles, fissure or fistula. They can be manually examined. So you need to go to an experienced doctor, get it examined for further diagnosis. See, first the doctor will or the physician will understand, okay, what is the category? Is it piles? Okay, if it is piles, what is the degree, grading, first degree, second degree, or it's internal or external? If it is a fissure, it's just a single fissure or multiple fissures, and how deep are the fissures? If it's a fistula, what is the angle, how long is the tract? All that assessment will be done manually by an examination by the physician. After that, depending according to situation of the patient, the doctor will advise further investigations like colonoscopy, sigmoidoscopy, or at times if it's a fistula, transanal scan or MRI fistula. So all these investigations will further confirm what is the exact problem, so that then the physician can tell the exact treatment for the problem.
Do we have stages in this, ma'am?
Yes, definitely we do have different stages. See, as I mentioned in piles problem or the hemorrhoids problem, you have first degree, second degree, third degree, depending on where the growth is, depending on that different positions are there. In fissure also, it can be a single fissure or just a very starting from a simple scratch and leading into a deep cut. Same thing with fistula, it starts with a simple tract and then it can multiply into 2-3 tracts, because there is pus inside and the pus can just seep inside and develop into multiple tracts.
Generally, how long will it take to cure these piles, ma'am?
Again, it depends from the according to patient's condition. So if it's a simple pile mass, it can be cured in Ayurveda through Shara Sutra. Ayurveda has a wonderful treatment for treating all these anorectal problems. It is basically Shara Karma and Shara Sutra. So if it's a single pile mass or a double pile mass, it can be treated within the sittings of 3 to 7 days or 6 days of sitting using Shara Karma procedure. If it's a fistula, it might take little longer sittings, depending on how many tracks are there and what is the length of the track. Depending on that, it can be 6 sittings to 8 sittings to 12 sittings. It depends from patient to patient. So we cannot commit on exactly how many number of days will be required. What we can commit is, yes, that definitely there is a treatment in Ayurveda, which is without surgery.
What are the treatments available in Ayurveda, especially how this Panchakarma treatment will be helpful in curing piles?
I already mentioned that there is a treatment known as Shara Karma or Shara Sutra in Ayurveda. I would say a 99% sure treatment where there is no reoccurrence of any piles or fissure or fistulas once you undergo this Ayurveda treatment. Plus to that, now see, once we treat the patient, the treatment is done. Now the next step is to see whether the treatment is sustainable or not. Okay, so because see, now the patient has come to me, I have treated the patient. Now how do we make sure that in future the problem does not come again? So in Ayurmegha, what we do, we guide the patient with a proper diet so that in future, and to how to take care of the body, what to do and what not to do, everything is guided to the patient in proper written documents, so that in future, patient is aware, conscious, about their own body. They understand their own body type and accordingly behave, So they follow the diet chart, they follow the daily routine, so that this problem doesn't reoccur to them. So that is how Ayurveda helps in this treatment. Plus in Ayurmegha, we make it sure with the follow of the patient that the patient is following all these guidelines.
Ma'am, how Ayurmegha is different from others, as you're telling that without any surgery or operation, piles will be cured permanently. So how is it different?
See, in Ayurmegha, we have, experienced doctors first of all and very experienced therapists. We have a facility, we have full facility where we have Ayurvedic experienced therapists and proper Ayurvedic Panchakarma setups are there. Plus, we believe in, serving authentic and genuine Ayurveda. So, we have our own research products, we have testimonials from the patient, and after, those research things that, okay, this is the kind of treatment that, and what we do, we don't give the same treatment for every patient. So, we, once a patient approaches us, we do a consultation with them, we do a deep assessment of the patient, depending on the patient's requirement and the build of the patient, what is the prakriti of the patient, depending on those things, what are the eating habits of the patient, what is the daily routine of the patient, for how long the patient has been affected by this disease, are there any other factors which are causing to the problem of this. But see, it can be, the problem can be physical, but we never know on mental level if patient is having stress or something, So we try to see or consider all this in our assessment. We try to consider all these types and then come to a assessment. Okay, after the assessment, we come to a conclusion, okay, that this is the treatment which will suit this particular patient. And that is how Ayurmegha is different, because we are not giving the same kind of treatment to all the patients. Plus, we do all the Ayurvedic parameters, plus we do all the modern techniques, whatever investigations are required, we do ask the patient to get them done. Once the patient gets them done, based on those investigations, we do the treatment, and after the treatment, again, we ask the patients to again get the investigations done, so that there is a comparative study. Okay, this was the condition of the patient before the treatment. Now this is the condition of the patient after the treatment, so that the patient also has a confidence. Okay, there has been an improvement in his health. So that is how Ayurmegha is different.
Okay, ma'am. So, what is a diet plan or diet routine or else lifestyle one has to follow if he or she is suffering from piles?
See, as I mentioned, the main cause of all these anorectal problems mainly is our digestive system. It's not functioning properly. So to keep it functioning properly, what everyone can at least they can do is drink sufficient water. Drink 2 to 3 liters of water in a day. It is very, very much necessary. Whether you feel thirsty or you don't feel thirsty, please drink that water. I understand, people are sitting in AC offices, they don't feel thirsty, but still then, make it a habit that you carry a bottle of water along with you and sip it every half an hour to 1 hour. Okay, that is one thing, because digestive system, to clean it, we need water. Second thing, add fiber to your diet. By adding fiber to your diet, I mean, please see that you're having salad daily, you're having one fruit, any seasonal fruit, be it any fruit, please have it daily. Third is add vegetables to your daily diet. Fourth is add buttermilk to your diet. It will help you in your digestive system and help you in healing of your all anorectal problems at a faster pace.
What lifestyle they has to maintain?
Lifestyle, they have to be regular with their habits. Timings is very important. So they have to have a disciplined life.
Like
it cannot
sleep.
They have to have a proper sleep. They have to have a discipline in their eating style, eating timings, their bowel timings. That everything has to come in discipline, which people are not following nowadays, and that is why these problems are becoming very common.
Foods to be avoided, ma'am?
Deep fried food items, non-veg food items, potato, eggs, and apart from that, a lot of spicy food items, bakery items, especially maida based items, they have to be avoided.
And what are the risk factors and complications in piles?
Yes, a good question. See, if any of the person or patient is having either of the symptom, either if they are having bleeding from their anal opening, burning in that area, or pain in that area, they should not ignore. Please immediately go to a good physician, get it examined, get the investigation done, confirm the diagnosis, and please take the treatment. Because if these problems, if they are left untreated, they can, again get increased to another problems. Especially like suppose now if you have fissure as it is to live with that pain, it's a painful condition, right? If you leave it untreated, there are chances that the fissure can get infected and it can get converted into a fistula. Many times, how people develop fistula, because they ignore this small problem, and later on they find out that it is converted into a fistula. Now, if a fistula has developed, if there is a tendency again to ignore that fistula, what might happen, that because there is pus over there, that area is already infected. So there are chances that that pus will travel deep inside and again develop into multiple tracts. At times, if left untreated, it can develop into cancer also. Similar with pile mass also. So if pile mass is there and as it is to live with that condition, it's painful. Patients are not able to sit, they are not able to focus on their work. Their life just goes random hayway. So it is always advisable, if you are having a small symptom, please don't take time. Please don't go to the medical store and buy some product from there. Just buy some OT product from there and use it. Don't do that. Go to a good doctor, get it examined, and please take the treatment. Because if you're not curing it at the right time, if you're not preventing it at the right time, there are chances that it might develop into a further grave disease.